Hi, we are going to be talking about microstriae post Lasik. Here, what we are doing is trying to find an edge. You can see these folds which are there just encroaching over the central area. With the speculum, this patient was complaining of slight vision. Vision was 6/9, 20/30. We are trying to lift the flap. So the whole thing here is to lift the flap, iron it out, and do the management as early as possible. We have gone under the micro flap. We are lifting it out. Early identification is very important, and here what we are trying to highlight is use of warm BSS and wet sponge ironing. We have partially lifted the edge, again going in and doing a complete right up to the flap edge. Go into it, polish, raise, polish, raise. Here we have taken a room temperature and a warm BSS, not more than 35-40 degrees, otherwise you will burn the stroma, but avoid cold BSS. Normally what happens is you have cold BSS with us for the cataract surgeries and all what you're doing. Now here you're seeing with the work sponge, what I'm doing is trying to remove these folds which are there. Gently. That's the trick. It's going to take a long time. What happens is with the warm BSS, the collagen fibers become little pliable and these folds which are seen can be removed. We are again going in, again going into the flap, again use a little warm BSS to try to iron out those folds which we are seeing. This is done 2-3 times. Again ironing it out. The care here is the wet sponge should be, and it has to be perpendicular to your fold areas. Usually these microstriae are caused because of a trauma or excessive rubbing, and early identification is very important. This is the third go which we are doing. Do it very gently. Around a minute, one and a half minute of wash iron is important. Here you can see now the folds are becoming a little bit lighter. Again ironing, wash and iron, wash and iron. There's a little bit of epithelial. Sometimes what we need to do is do a little bit of epithelial debridement if you're taking up the case after a few days or a few weeks. This is done. Now what we are doing is trying to evert the edges to prevent any epithelial ingrowth, and again remove the excess fluid which is there to prevent any further lift. I will wait now for at least 2 minutes, and then you will want to put in contact lens. Post-operative contact lens a little longer, 2-3 days, antibiotics, steroids, no trauma, no rubbing of the eye, and take care of diffuse lamellar keratitis and epithelial ingrowth post-operatively. Thank you.